As you would imagine, this crisis is impacting first responders and healthcare professionals. Tonight, we're joined by Michael Wargo, the Vice President and Chief of Preparedness and Emergency for HCA Healthcare, which has facilities in Texas. Michael, thanks for being here.
Aaron, thanks for having me.
What are the major challenges you're facing because of this winter weather storm?
So HCA Healthcare operates just over 70 hospitals across the state of Texas. And the biggest challenges that we're facing right now are just disruptions in the utilities and the infrastructure, the water systems, the power systems, and just some of the needs within the community are presenting a challenge to our staff and to everyone living there. The water challenges have really impacted not only our hospitals, but dialysis centers and community centers. So these are some of the resources that our Enterprise Emergency Operations Center here in Nashville has been supporting the local communities with in terms of getting them resources there in Texas.
Michael, I can't imagine this has been easy, but when you're talking about electricity and water, how do your healthcare facilities handle those when both problems are presented in such a short amount of time?
So it's certainly a challenge for all of our hospitals and the community as a whole. But the HCA Healthcare hospitals and other hospitals across Texas and other parts of the country all comply with emergency preparedness standards. So there are regulations that require us to have emergency generators. And the big challenge for us in this event with the generators is the Texas hospitals typically don't have additive that prevents gelling of the fuel. So this is something that we had to quickly add to the fuel so that when the rolling power outages came through the region, and if it impacted any of our hospitals, the generators didn't freeze up. Related to the water, there's a couple factors related to the water that we've experienced. One, the pipes for fire suppression, the sprinkler systems, froze up and ruptured on some of the hospitals. So the challenge for us there is managing water that's in the facilities and cleaning up. When you look at the utilities across much of Texas with the deep freeze, many of the community water lines have frozen. So that resulted in two things for us. One, low pressure to some of the hospitals. And you can imagine the amount of water it takes to operate a hospital, from the boilers to produce heat, to keep our buildings warm for our patients and our staff, to just cleaning surgical instruments in the sterilization to keep the operating rooms open. Secondly is when we have, or thirdly, when we have no water to the facilities, that's a true challenge that's compounded. So for us and other organizations, we were challenged with bringing tanker trucks of water. Now, the scale of HCA Healthcare from really Alaska to Miami in providing services, we've got a lot of resources that we can lean on. And for our local community there, for our staff, our heroes that have been working in our hospitals, we rely on all of the resources that come to bear from HCA Healthcare. We're bringing tanker trucks, 6,000-gallon water trucks, 10 or 12 of them, as far as Florida and North Carolina and Denver, down into different regions of Texas to supply water to our facilities. Challenge has been getting them there, in the sense that we can't bring them in too soon, because then they'll have to drive on treacherous conditions or maybe just stop and not be able to transport over the highways. And then we have to look at the temperatures. If we connect those water tankers to the facilities too soon and we don't go through all the water, the tanker trucks themselves are at risk for freezing. So there's compounding challenges with this event that we've been faced and we've been able to overcome thus far.
All right, so what are the most common storm-related injuries that you're seeing? I know you mentioned taking care of your employees, and that is important, but as we look at people who are having to use your facilities, how are you treating them and what are the injuries you're seeing?
So some of the biggest volume of injuries that we're seeing now post-event are slips and falls from the amount of ice. There's certainly a demand for cleanup of the ice, but we're seeing a lot of slip and falls within the communities. It's driving the 911 volumes in the communities up, and it's starting to jam up some of the ERs in a sense. Other injuries that you typically see, and we're seeing smaller numbers of this, is carbon monoxide poisoning from folks that have no heat within their homes, and they're using generators in their homes or using them in their garages, and they're not ventilated appropriately. So that's causing carbon monoxide poisoning in some cases. These patients can be critically ill and not even know it. Carbon monoxide creeps up on individuals. It makes you drowsy, typically puts you in a sleepy state. So some of those patients, by the time they're found, there might be in a latent case of this. Hopefully they have CO monitors or CO detectors that allow them to have an awareness that the carbon monoxide levels are creeping up, and they can ventilate their space much better.
Michael, we're running out of time, but I do want to ask you one final question. This is a very unique last 12 months. Is there any way to put into words the difficulty around a historic winter weather storm during a global pandemic?
This is the year of never events. Things that we would say would never happen have certainly happened, from global pandemic, forcing our healthcare heroes to work really double time, to now a deep freeze in Texas. And now it's time for us to give back to those heroes. And some of the things we've done have really stood up mini markets to provide food and supplies for our healthcare heroes. And it's time for us at HCA Healthcare and our broader community to give back to those heroes in their time of need.
Michael Wargo, thank you so much. HCA Healthcare, we appreciate you taking the time.
Thank you. Have a good evening.